All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions that we've received through today, the 21st of September. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Vinay Debracula, who is an intern this summer with the Institute. And Vinay, I now turn it over to you.
Thank you, Kristen. So as we always do, we'll start today with just updating everyone on some statistics about COVID in the United States as well as the state of Illinois. So in general, in the United States, the vaccination rate has reached 52.8%. It's a gradual rise. It's showing a very consistent rise almost daily of about 0.2%, so that we're seeing continued use of the vaccine. We're seeing our vaccination rate increase slowly. And so if it continues on this trend, it looks to a point where we could continue to grow that vaccination rate to over 60% and then eventually over 75%. And as a result, since September 14th, our per day positivity rate has continued to decline. We're now at 148,000 positive cases per day, whereas last week we were sitting at over 150,000 cases per day. So while the drop is minor, it is still a drop, and the drop is still a positive thing. Then in terms of the state of Illinois, we continue to see a similar trend. The vaccination rate also continues to increase, as sitting at 52% fully vaccinated. And as a result, our per day positivity rate has also declined, where it was at 4,100 last week. Today, it's at 3,700 positive cases per day. Compare that to states like Florida and Texas, where Florida has 10,900 cases per day and Texas has 16,000 cases per day. Illinois is doing substantially better in terms of the per day positivity rate. However, it's important to note that states such as Florida and Texas have also seen a dramatic decrease in the positivity rate. Where Florida was sitting at nearly 15,000 last week, they've seen about a 5,000% reduction. And then Texas, sitting at 20,000 last week, seen 5,000 case reduction as well. All in all, the states around the country are slowly starting to break that curve. We're slowly starting to look in a positive direction. Then we go to some headlines. First, the question that everyone is asking since the start of the pandemic: what is going on with COVID restrictions, and are they going away? Well, it's important to note that as we continue to reduce the spread of the pandemic, and as we continue to see that fourth wave go downwards, the Biden administration has started to kind of reduce the travel restrictions that are in place, where international travelers coming into the US now can be fully vaccinated. However, they can all international travelers. It's no longer very restricted travel in terms of into our country. But then, Dr. Murphy, one question that comes up with that is, how does this pandemic compare to those in the past? And is it doing better? Are we doing a better job? And how is it looking in future prospects?
Well, the last big respiratory type pandemic was, of course, the flu pandemic of 1918, which went through 3 big waves and several years, starting at the end of World War I. And we've actually hit the same number of deaths recorded. And we have 3 times as many people in our population. So on a per capita basis, it's less, but as far as hard numbers, it's the same. I mean, 680,000 deaths. I mean, this is now one of the most common causes of death in the United States. And compared to 1918, I mean, they didn't even know back then that it was a viral disease. They thought it was a bacterial disease or a bunch of bacterial diseases. Several books have been written about this and described. They did the same thing though. Masks, social distancing, being outdoors as much as possible. They had the school outdoors, even in the cold. It was, very similar things, similar arguments about not wearing the mask and not doing the mitigation and, wave after wave after wave. So there's a lot of similarities, but the sad thing is that the numbers now are equal. And because of the advancement in science, we've got, we know exactly what causes it. We have tests now available for everybody, from simple at-home tests you can buy in a pharmacy to very sophisticated PCR tests done in most hospitals and big clinics. And we have a vaccine, and we have monoclonal antibodies, and we're developing oral therapies. All that stuff is going on. And, to quote this doctor from the University of Michigan, we've really, as a population, this is Dr. Howard Markle, the University of Michigan. Big pockets of American society, and worse, their leaders have thrown this away, thrown our scientific benefit away, and that we could be doing much better now if we really all got on the same page and consider the virus as the enemy and do whatever we can to control it. But anyhow, things will turn the corner, and things are, as you just mentioned, are getting better.
Yeah. And it's also just important to remember that while the COVID pandemic has in no way been kind to us, in terms of comparison to the Spanish flu, where we had 1/3 the population, COVID, with all those scientific advancements, we're doing a better job combating. And then as we continue to see scientific advancements with COVID and continued research with COVID, we continue to look into how it's affecting kids of a younger age. We want to be able to give them that vaccine, and in so we have to make sure that it's safe for them. But in terms of actual pandemic response for these kids in the younger populations, studies have come out that say that kids' upper airways are actually pre-activated to fight the coronavirus. Their airways have these sentries, including some that excel in terms of recognizing the coronavirus. And so they have a kind of automated response to the virus when compared to adults. And so, Dr. Murphy, do you have anything extra to talk about how kids are responding to the pandemic, and then maybe in terms of future outlook, how they might be able to get the vaccine in the future?
Well, with this type of infection, with this specific infection, SARS-CoV-2, this coronavirus, the kids are responding better to it. They can fight it better early on. They get less severe disease, less hospitalization, but still we have 534 kids dying from coronavirus. Compared to influenza, it's kids of all ages, whereas with influenza, it's the younger a person is, the higher the risk, the younger the child is. So there's kids just are different, and they do better with the virus. As you get older, that SNAP response, immunologic response, kind of goes away, and it takes a couple days for the immunologic response to surface, and that actually gives the virus enough time to set and cause all sorts of problems in the adults. That's why they do worse. Still, most people have very mild disease, and most people don't end up in the hospital, but the ones that do, of course, do very poorly.
Yeah. Awesome. And so then we look towards Chicago area and what is happening in the Chicago area, how COVID is doing in the Chicago area. And so one thing that's important to note is that Pfizer said it's ready to seek approval from the FDA to give its COVID vaccine to kids ages 5 to 11. And in the Chicago area, several doctors are saying that is a huge step in containing this pandemic, as a lot of the new cases now are elementary students who are in that age group. And so do you think that this approval will happen in the near future?
It's going to happen in the very near future. What has happened and what was announced, I think just in the last 2 days, is that in the study of over 2,000 children, they of 5 to 11 years of age, they received just 1/3 the regular dose, but they develop an antibody response that's equal to the full dose given to the kids that are older. This is no surprise. Kids don't take adult doses of anything. We don't have the clinical data on that yet, but we have the antibody data, and it looks great. So that's a step in the right direction. Plus, they didn't report specifically about the side effects, but that will be forthcoming. But I mean, they didn't mention that it was not tolerated or whatever. And generally kids tolerate these vaccines. So it looks very much like this emergency use authorization for kids 5 to 11 will be approved by the end of October, when they get the rest of that data analyzed and presented to the FDA. So that will mean basically all school age kids from age 5 and up are going to be eligible to take a vaccine. And since so much of the epidemic now it involves the children, not so much in getting sick, but in spreading the infection to the family members and other people in the community, and all these quarantines we have with these schools. If they all get vaccinated, this is going to have a tremendous effect.
Yeah, that's very exciting news. But one important thing to note for all Chicago area residents is that there is a possibility that restaurants and indoor entertainment venues start to require proof of vaccination for entry into these various locations. Do you think that's going to happen also in the near future?
It's already,
I know San Francisco, New York, and New Orleans have already put that requirement in place.
It's already happening, as you just mentioned, and it's happening all over the world. It's happening in Europe now. It's going to, this vaccine requirements are going to spread like wildfire, really, because that is really the best way to control the pandemic. Just keep the unvaccinated people away from groups of vaccinated, and you'll have, you won't be able to spread this thing much further. Because in restaurants, of course, you can't eat with a mask on, so there's no way you can really mitigate. Same thing with bars. Movie theaters and theaters are a little bit different because you can slap a mask on everybody in the audience, but you can't with the actors. I mean, they're acting or they're singing or whatever. So it's best to have everybody as protected as possible. But you're going to see this everywhere, and it's starting to, in Europe, they're much more strict, and they're starting to just begin the mandates in transportation. So domestic air travel, even train travel, and Europeans take trains quite a bit. You may have to show your vaccination just to do that. I mean, that, the unvaccinated over there are going to have a really hard time. Right. And the same thing could happen here. There's pressure right now on the administration to spread these mandates to include transportation and big venues. So I think you're going to see this kind of slowly, getting accepted and slowly expanding throughout the community.
Right. Awesome. Now we can move on to the viewer ask questions part of the segment. And so we'll start with the first question, which asks regarding this children approval of the 5 to 11-year-olds. It's been said that the Pfizer dose for these children is about 1/3 of the adult dose. And so some people are concerned that this may not be the most effective dose. And so should they be waiting for, if their kid is 11, for them to turn 12 to get the full dose? What is kind of the situation in terms of, is it less effective to get 1/3 dose, or is it just more safe and just as effective in children at that age?
This is a very practical question, because there's a lot of people that are 11 that are turning 12. Of course, what happens? So anyway, there's no magic about the day you turn 12 compared to the last day you were 11. All right. It's not like on that day something really different happens. I think we'll see what they put in the EUA, the emergency use authorization, when they authorize this, because there must have been some kids that had that. So it looks like the immunologic response to these vaccines at this lower dose is very good in 5 to 11. So, they can tweak out the 10 and 11-year-olds versus the 5 and 6-year-olds. There's ways to look at this. And so when they do that, they will make a recommendation that includes what to do with somebody that turns 12 between the first and second dose, which is not going to be a whole lot of people.
Right.
But frankly, I don't think it's going to make any difference. I think right at that age, looks like they're all responding, but we'll see.
The next question comes from a woman who had COVID in November of 2020, pretty mild, not really any symptoms. And then they had the Pfizer vaccine this year, but they're wondering, since they have asthma and they're required to take medicine twice a day, they're wondering if that is an immunocompromised condition. And the reason is because they're going to be a candidate for the booster, but they have to wait until they're 65, and they're kind of just wondering, should they just get it now? Are they eligible to get it now, or should they wait till they turn 65 in February?
Yeah, so just another one of these slightly complicated ones with no really good answer. Some of the medicines used to treat asthma are immunosuppressant because asthma is like a hyperimmune response, response to the airways. And fortunately, with COVID and asthma hasn't come up really on the higher risk. However, if you get pneumonia and you have asthma, it's really not good. So anyway, what I would say with this person is I'm not sure the medication that this person is on. If it's a steroid medication or something with immune suppression, definitely. But I would say, this is close enough that, and you've already had COVID once, you were sick once, the Delta variant is very nasty, in that I would think that you would qualify under the EUA and get it now because you're immunocompromised, possibly. And, according to that EUA, you have to attest to the fact that you have an immunocompromised condition. Now, you can ask your physician that's taking care of you what they think, and you do not have to actually tell the pharmacist or who's ever giving you the vaccine exactly what that condition is. That's all guarded under HIPAA, and you just have to attest to the fact that you have it. Your doctor has said that to you, then you can take it now. You don't have to wait until February.
Awesome. The next question regards several people's question on, just when they have Regeneron infusions. And so they, measure their antibody count, and several people, who return high antibody counts think that maybe getting the vaccine would kind of be an overload of stimulus in terms of antibodies. And so maybe it makes it less effective. They're not sure. A lot of these people aren't opposed to getting the vaccine, but they kind of want some guidance in terms of do they need it, and should they be getting it if they have a very high antibody count? And so I direct that question towards you. What really is the true answer in terms of, do the antibodies really matter, and does everyone not just need a vaccine?
Yeah, no, this person has already had COVID, had the Regeneron, and you don't need the vaccine within the 90 days of taking the Regeneron and having COVID. But this person's after that 90 days, they should base the decision on the current guidelines, which is get vaccinated now. You'll have a remarkable antibody response because you've already had COVID. The antibodies you got from the Regeneron are on their way out the door. The antibodies you got from having COVID are going down kind of slowly. It's hard to predict. One thing is, you cannot make a clinical decision based on doing one of the commercial antibody tests. That is not going to really be helpful. And so I don't suggest even testing that. Just follow the guidance now, and that's the safest way to go.
Agreed. And then our last question of the day regards the third dose or the booster shot. And so their question is regarding the booster shot on the third dose is, you mentioned, and it has been said several times just in articles and stuff, that the booster shot is the same thing as the first two doses. And so some people are just wondering, if the first two doses aren't as effective against the Delta variant, why aren't they tweaking that third dose to make it more effective, and maybe, for other variants in the future? Is it just adding immunity that makes it way more effective regardless, or should they be tweaking the vaccine a little bit?
Well, let's get this straight. There is no tweaked vaccine. There's no version 2.0 yet. Believe me, these companies are working on an improved vaccine for the next generation of variants. But that hasn't happened yet. And we don't know when that's going to happen. It's going to be, could be many months, well into the next year before a different version comes out. It's been remarkably quiet about that development. It's certainly doable and it's going to happen. But the question is when. So in the interim, with all this data now about the antibodies going down after the Pfizer vaccine and people getting breakthrough infections, you should get your immunity boosted as much as possible. So follow the guidelines and take the booster when you're eligible. Take the current booster. When version 2.0, when the tweaked vaccine comes out, take that.
Yep.
But don't wait for that. It's just too dynamic out there, and the variants are just too nasty, and you don't want to get infected if you can avoid it.
And then the last question for this person is regarding their son who's in high school, who's potentially attending a homecoming dance, and the homecoming dance is outside. The son is fully vaccinated. The details about the other students are not available. However, all the son's friends are supposedly vaccinated. And so she's wondering, what is the safety level in terms of this event being hosted?
Well, it depends. There's a lot of depends in here. So first of all, they're having it outside the end of October. Good luck. If you're in Illinois, you don't know what's going to happen. But,
right.
But, that's a good thing, being outdoors. The risky thing here is still you're congregating a lot of people that are going to be mixing with unvaccinated and vaccinated. That is the risk. And so, if they say, yeah, it's outdoors and everybody that comes has to be vaccinated or has to have a test, a PCR test or some test, within 2 or 3 days of coming, that's one thing. That's the Lollapalooza approach. Right. Or, are you just going to mix the unvaccinated and the vaccinated? The school kids are not heavily vaccinated at this point yet so far. The only school district I know that is mandating the vaccines is LA County, are mandating vaccines for the teenagers and preteens. So, if you want me to tell you that it's safe to do that, I can't do it. Because mixing vaccinated and unvaccinated people is not wise. It's risky.
Well, yeah. And we've said that time and time again. Mm-hmm. That's all we have for today. Thank you so much for your help, Dr. Murphy, as always.
Great. Thank you, Vinay. Thank you for all your help. Today's Vinay's last day with us. He's going back to school, and good luck with your studies.
Thank you. I appreciate that a lot.